Hey guys, it's Dr. Pearlman, Paramount Chiropractic and Wellness. And what I want to do is make a quick video today because after a patient was in here earlier, we brought up a particular exercise that's good for pelvic and lumbar stability. Remember, not mobility, but actually becoming stable. Exercise we recommend, but actually found out that it was actually hurting her pelvis to do it. So I want to show you that there's more than one way to skin a cat, as they say. And here's two examples of getting the same effect from an exercise. So let's say you have chronic lower back or sciatic type pain, or pain that maybe radiates down the butt once in a while, or you feel unstable in the pelvis, or you've had back pain to where your back has gone out. A lot of times I recommend for people to do this exercise, as Dr. Axel always participating, the glute bridge. So if we're doing a glute bridge, not only are we activating our core muscles, and there are ways we can push our feet out, forward. We can press our ankles out to the side, or our heels, out to the side, to get better core stability and lumbar stability. But the thing is, if you have a lot of osteoarthritis of the joints, this especially applies to people that are older, if you have osteoarthritis here, when you do this, you might get a little bit of discomfort and pain in the lower back. So one of the things I encourage people to do to get the same stable effect is from all fours. And of course, if you have bad knees, I encourage everyone to either wear a knee pad if you need to, have a pillow, have a really thick yoga mat, double yoga mat. There's no reason that you can't do this other than that you're too immobile, which would be a problem to not be able to do this. Because remember, we want to be able to lift ourselves up off the floor for the rest of our lives. So if you're on all fours, it's opposite hand, opposite leg. When you do this exercise, you do not need to be able to lift your leg up high or do some kind of balancing act. Everyone, this is very low. Keep the toe just off the ground. And when you're low and keep the toe just off the ground, you don't even have to do that many reps. You're activating your glutes. You're lengthening that anterior psoas muscle, and you're creating stability, believe it or not, through mobility by activating your core muscles, keeping your spine neutral. And if you're doing this exercise, you can control how much flexion or how much extension. Again, for those of you with osteoarthritis in the spine, the extension as you drop down would actually hurt your back a little, but you can control it like this without having to have the binding that would happen if you were on your back. So you can try one or two of the, or one, the other, or both of these exercises to see which one is more comfortable for your lower back, your pelvis, your core, and see if that makes it feel better if it's tight or you're having any symptom in the lower back. Of course, nothing's going to replace the chiropractic adjustment and what it does for the neurology when it comes to reducing the amount of pain. But I wanted everyone to be able to see this video here today. So please excuse Dr. Axel, and we'll see you next time.